So, infection control, complete review. I think we've been through 100% of this. It's just a matter of making sure that we're understanding the vocabulary. There's some different vocabulary in it. Anyway, we understand that there's microorganisms everywhere, okay? Some are healthy, some are harmful. Some can do nothing to you except, give you like a feeling that you have something crawling on you. The others can put you in the grave, all right? So what we want to do is we want to make sure that patient care-wise that we're not spreading these microorganisms. We don't want the patients infectious little bugs, and we don't want to give them infectious little bugs, okay? OSHA and the CDC, there are questions on there. What does OSHA do? What does CDC do? Okay, so you have to understand their role in that. OSHA is workplace safety, CDC, infectious disease center, right? So make sure that we're there. OSHA, blood-borne pathogens, they set the standard for blood-borne pathogens. Okay? So you have these, the first vocabulary word there, immunocompromised. The immune system, you have people who their immune systems are compromised. Who are those? Age, yeah, that's the big, but who is that? Why do you have to have the flu shot to go to the hospital? Yeah, because you are around a lot of people who are immunocompromised. They're sick. So the sick people that you come in contact with, your patients, they're the ones that are immunocompromised. Their immune system is compromised some way. So that's why you have to have vaccines, so you don't compromise them, okay? And they don't compromise you. Asepsis is different from sterile, right? Asepsis is essentially clean, a clean standard, okay? So washing your hands, cleaning surfaces down with the cleaning solutions, like in the emergency department, patient goes away, they take those wipes out of that commercial container and wipe that down, right? They let it stay on that bed for a certain period of time and let it dry, because everything has to have a dwelling time on it. The same way with the stuff on your hands. You use hand gel, you need to leave that on your hands for a certain period of time so it has a dwelling time. It's not like a nuclear little microorganism bomb, right? It takes a little time to kill those microorganisms. So that's what we do. Catheters, sterile procedures, we want to make sure that anything invasive procedures, anything that we're doing invasive, which is nothing for the PCT, because PCTs don't do invasive procedures. Well, yeah, you do. You draw blood. That's an invasive procedure. Okay? So you want to make sure when you're drawing that patient's blood is that you're using an aseptic technique. You're using a clean technique, okay? When you do it. You don't remove all the germs, but the majority of them, okay? So you'll never remove all the microorganisms, but you want to remove the majority of them. And we know the most effective way is how? Washing your hands, okay? Your rings, all these things that are on your hands, why you have to have short fingernails at the hospital, why they say don't really wear these big rings and these different things is because microorganisms get in there and they hide, okay? People who chew on their fingernails, anybody in here still? The most common thing under people's fingernails is what? Poo. Fecal material. That's the most common scraping under people's fingernails. Anyway, it gives you steps on how to wash your hands, right? And we've been over this. Warm water, soap, at least 20 seconds, right? We sing Happy Birthday or the ABCs, right? So when you do that, wash around your wrist staff, for some reason, and I don't know the reason why, staff for some reason likes to hang out right here on the wrist. I think it's because they're sort of sweaty or something, that maybe promotes a little bit better environment.
But then it would be
okay.
better.
But you wash your hands and then around your wrist, because that's where the staph. We all have staph on us, right? It's all over our bodies. It's just sort of crawling around looking for an open spot to go into. That's why we want to wash our hands and be really clean about it. Once you rinse, this says use the air dryer, but we know that that's a no for right now. Most of the stuff comes out of that air dryer is bacteria. If you have the air dryer in the bathroom, most of the stuff that blows back on your hands is poo. So you want to either let them air dry or towel. Then when you exit the room, or to turn off the water, you use the towel to turn off the thing so you don't expose your hands again. Okay. And we've been through all that. Once you go into the room, you wash your hands or use the hand sanitizer, right? And then you put on the gloves. Now this is odd because you wash your hands and try to put on the gloves. It's sort of a bear to get those gloves on, okay? But that's according to the book. You wash your hands and put on the gloves. You do your procedure, okay? And then, like say you're taking a bandage off, you're changing the dressing, so you take that dressing off. Now you have dirty hands, right? So you take the gloves off before you start the clean procedure, right? And put new gloves on before you start the clean procedure. And then once you're done completely, wash your hands again, and then put the gloves in if they're dirty, put them in a biohazard bag, right? Some things don't go along with the hand gels. They have to have soap and water, like C. diff. C. diff doesn't, if you have C. diff on your hands, it doesn't, the hand gels, they don't work. It's like a cocktail to C. diff. They go, oh good, hand gel again, 60% alcohol. Thank you very much. You have to have soap and warm water for those. E. coli, this sort of the same way. When you use the hand gel, make sure that you use an adequate amount. Like if you're using alcohol based, out of the little bottle, you should be able to see that on your hands. Should be a good shine to it. In the hospital, it's about the foam stuff. It's about the size of a golf ball. You want quite a bit of that in your hands. On your hands, rub it in between your fingers and around your wrist in the same way for about 20 seconds. So you sort of rubbing that on there. You have quite a bit on there, so it says in the book to rub till it's dry. But according to microbiologists, a lot of them, you want to leave it wet and just let it air dry. You don't really want to rub it till it's dry. Leave it wet and then just let it air dry. It won't take long. It's alcohol. It's going to dry really quick, right? So, but go by the book in here to rub it until it's dry. When you talk about surgical patients, okay, so they just came out of surgery, so some of those are sterile dressings. So a sterile dressing or procedure you would only assist in doing. You're not allowed as a PCT to do sterile procedures, okay? But if you're changing the dressing, like a surgical wound, a dressing, okay, so that's the same way. You would change it, change gloves, put the clean stuff on, look for redness, infection, pus, anything that's sort of abnormal with the wound, and then tell the nurse about it if it's abnormal. If we have a package here, and we have a sterile field, okay? We can use our pretend minds and say this here, and this is a sterile field right here, okay? You want to keep the sterile field above your waist, okay? And then you want to open everything away from you. if you touch any part of the sterile field, the whole thing is unsterile. It's contaminated. So you have to, technically, you have to trash the whole thing. Okay, which some of these things are hundreds of dollars. Okay, so if you touch the doctor or whoever's doing the sterile procedure, the whole thing. They have to start all over. Okay, so what happened is they want you to open different things for them. Anything that's in the sterile field, they have to open. You can't touch it unless you have sterile gloves on. Okay, you can't touch it with regular exam gloves. So the things that are in their sterile field, they will open with their sterile hands, right? But they may need you to, like, give them another needle like this. Okay, in this package, it's sterile. Okay, this is a sterile package. When you open it away from you, and then you would reach over here and dump it out on the sterile field and just let it fall. You wouldn't touch it. Okay, if you were to touch that, then it would be non-sterile and you'd ruin their sterile field. Okay, a Foley catheter is the same way. Once the nurse starts placing the Foley catheter in, and you may have seen this, one hand is not sterile and the other one's sterile, so she can't, or he can't interchange these. So it takes a little concentration on what to do with the hands. You may have one hand that's non-sterile, one hand that's sterile. Okay, so it does take some work, but you want to make sure that you're opening away from it. There's a list here on procedures that you would do. Okay. Check the expiration date, the integrity of the package. I think those are probably questions. You know, you have a needle where the seal has been broken, you throw it away. You're making that assumption whether or not that it's still sterile, right? So that's really easy stuff to understand. Cough etiquette we know about, right? Thanks to Mythbusters, we know how far that sneeze goes. It really goes about 3 feet. Even if you cover it with a Kleenex, it still sort of shoots out a couple of feet. Episodes you can see it on YouTube about sneezes. So this, when you cover your cough with your hand, the sneeze actually is directed down towards your feet, not out. So it would go, your spit zone's about 3 feet here. It's still here. See, you're just right on the edge. Each one of these marks are 12 inches. So 1, 2. Here's the edge of the spit zone. So if I stand here, you're in the spit zone. Okay. If I back up here, you're not in the spit zone. 3 feet away. And that's why you want to stand to the side of your patient. You don't want to stand in front of their face. Respiratory droplets. Okay. So hand hygiene. You sneeze or cough, wash your hands, right? We all know this from life, hopefully. There is a generation that's quite a bit older than you. They're probably 40s to 50s-ish. That's for some reason along the way, they weren't taught proper etiquette like this. I know it just from sort of casual observation of patients that people in this age group, they'll cough, sneeze, and they won't cover their cough or sneeze, right? You know what I mean? They'll turn right at you. You know? There are several questions on disease transmission that break that chain of infection. You remember we talked about that. There's this chain of infection that's in your book on 74. You need to know what this is. So you know what the pathogen is, right? That's the virus, the bacteria, right? The reservoir is, who's the reservoir?
The person.
Us. We're the reservoir. The portal of exit, okay, that uses the The portal exit is the passageway that the pathogen uses to exit the reservoir. Oh. I'm copying something. Okay, so make sure you know these mode of transportation. If it's direct, like an insect, like the little bee that stings, that's a direct. A needle stick, that's direct. Indirect would be the cough. You know, portal of entry, any orifice that you have, eyes, nose, mouth, ears, right? We don't understand why our throat hurts because we try to dig out that wax with scratch our ear with the dirty hand, right? Why is my eye all red this morning? Because you probably rubbed it with an unclean hand, okay? Any port of entry that it will happen, and the longer you stay in medicine, the more that you get used to making sure, like when I have, like my eyes are like itching out their skull, right? And I resist that as long as I can until I can get over to the sink. I'll wash my hands or use some hand gel or something, let it dry, let it have its time, and then rub my eye. Okay? You have to sort of think about this. My hands are dirty right now because they're not clean. I've been touching everything, the mouse and in there and this book. So all these are dirty. So the last thing I would want to do is rub my eyes with a hand. I have to resist that until do that. Same way with, let's say that I'm where I can't wash my hands. A lot of times what I'll do is I'll take my shirt or something and I'll do this on the inside and rub it, right? Sort of just to get used to. And then susceptible host, that's that patient that's immunocompromised, okay? Without getting into the debate over vaccines, this is the problem with the flu. The flu is, I mean not the flu, the flu as well, but the measles. Man, they are affecting other people, not. So, need those vaccines, okay? So what we need to do is break the cycle. So the way that we do this is clean the surfaces, clean our hands. We touch a patient, we wash our hands, right? Viruses from the skin and even sweat. It's rare, but it's there. So without becoming a germaphobe, right? Wash your hands. Keep your hands washed. Okay? Keep them out of your places of entry, for sure. And then they have that infection. There's these stages of infection that takes place. You get the pathogen that's introduced in there, then you start getting this inflammation process, okay? Where you know if you have here and if it's red, it's all puffy, and then you touch it and it's hot to the touch, it's warmer than your skin, that side is infected, okay? Because the body raises that temperature. They send the white blood cells and these other cells up there to sort of try to kill that. They know, the body knows right away when there's something that's abnormal that takes place in the body, and they send white blood cells and these other sort of cells to up histamines and all these other things up there to sort of look at that and see if it's infectious. Even when you get a shot of medicine, right? You get a shot of the vaccine or anything, the body sends that up there and looks at it and like, oh, kill that, or what do I need to do with that, right? So if it gets up there and it's more than the antibodies, then it gets infected, right? And so it could get in the lymph nodes and in different places. So it increases white blood cell count. So it gets the white blood cells get up there and go, oh, we need more. We need more white blood cells. It's too much. So they send more white blood cells up in there, and this is where you start. White blood cells is essentially a collection of those. And so what we don't want is this new word here, septicemia, leading to septicemia or sepsis. Sepsis in the blood. A septic patient is really sick. The easy form of sepsis is a really bad infection, okay, that's covering the system. But some of the sickest people I've ever taken care of have been septic, from pneumonia or different infections, okay? But septicemia is the essentially, to paraphrase it, it's the infection that gets in the bloodstream. Okay, so we don't want to do that. Once it gets in the bloodstream, then it goes through all the body, right? So we don't want it to get into the bloodstream. You have the different types of infections. You have an acute infection like a cold. All right, acute, we already know it's a sort of a sudden onset. Chronic, hepatitis B, these other type of infections that are chronic over time. Latent, L-A-T-E-N-T, right? They sort of lay there until the person becomes immunocompromised. And then we talked about like a cold sore. It gives the example of a cold sore here. It's latent. It's laying there until it's the right time. And for some reason, this microorganism is pretty smart. It knows the right time. If it, like an opportunistic virus, it's going to lay there dormant until the immune system drops, okay? And then it's going to say, oh yeah, it's time to get up. Let's go infect this person. Right? Because if it got up too soon when the immune system wasn't compromised, then the body would just kill it. Okay, it's a weaker virus, so the body would just kill it. When is your immune system compromised? Sick? These cold sores? Anybody have problems with cold sores?
No.
Cold sores? Stress? Like, what about canker sores in the mouth?
Those.
You got problems with those? Those are the herpes simplex. It's just a herpes virus. Okay? What's the problem with cold sores? What? All of a sudden the cold sore pops up, or a little canker sore pops up.
Infection.
No, because it's not bacterial, it's virus. But
it's open.
it's like, man, where did that come from? If you keep track of it, if you keep track of these little canker sores or these cold sores, most of the time they're going to pop up when you're at your weakest point. Either you're really stressed about something, okay? You're sick. You're getting sick, okay? Or you don't get enough sleep, right? It's the same way. Sleep decreases the immune system. That's why you need X amount of hours so to keep your immune system strong. Lack of sleep will decrease your immune system, okay? When I was in paramedic school, I got these canker sores that went all the way down my throat. I couldn't hardly talk. I had them on the tip of my tongue and all the way down my throat. Okay, went to a family friend. His dad was a doctor, and first thing he looks at that, and he goes, "That's horrible." Yeah.
Really?
He goes, "Are you under any stress?" He goes, "Well," I said, "I don't know. I'm taking 2 summer classes. I have 300 hours of clinical for EMS to do, and I work all night." So, yeah, I'm a little stressed. I have to do this all within the summer. He goes, okay, let me give you something to relax. You know, you can't again give me anything to kill those because it's a virus. You guys got to run its course, okay? But he related all that back to stress, you know. So anyhow, so types of infection, look through that. PPE, our gloves, our gowns, different things. We're already familiar with that. You're familiar how to take your gloves off where you don't, you know, you go under the cuff and you pull them inside out, right? You should be familiar. You'll see a lot of people, and especially ER, they take their tip off their finger to palpate a vein. That's really a no-no because now you got to re-clean that. Plus your fingers compromised. Okay. We wear gloves. Gloves is the standard precaution. Okay, but we have a mask. You might wear a mask for air droplets. So if someone had the flu, and you're doing the flu swab on them. Because when you stick that, or the strep swab, I mean, so you're doing strep swab. More than likely, when you stick that strep swab in the back of their throat, they're going to do what? Cough. So it's a good thing to probably have a mask on, right? Because you're in the spit zone. You have to look down their throat to get to the back part of the throat, around the tonsils and everything, where those pus pockets are. So you're swabbing that, and if they cough, then you're right there. So it'd probably be pretty good to wear a mask for respiratory flu, respiratory droplets, right? We want to wear a mask for those droplets, okay? Gowns is for anything with splash or contact. C. diff, if you're taking care of that patient with contact isolation and they have C. diff, then you don't want it on your clothes. You can't kill it, okay? So all of a sudden you get C. diff on your clothes, and all of a sudden you know you're messing with your clothes. Now you have it on your hands, right? Then you do the port of entry, and then you're going to experience that agonizing bout of diarrhea and feeling really bad for days. Okay, shoes and head coverings, like in surgery, you have to cover your shoes, cover your head, right? We want to make sure that we use these universal precautions with different patients. The health, because we don't want healthcare associated infections. And there was some questions over that. You know, infections that is related to healthcare. So if I take care of you, and then I go, we watch the film in orientation where that yellow, it mapped out where that guy was walking, right? So I touch here, then I go touch here, and I touch here without washing my hands, and then I do this other procedure. Now it's just spreading that infection. That's healthcare related, right? Healthcare associated infections. Airborne, we talked about that. They may be, like if you have someone that's suspected TB, they have night sweats and fever and coughing up blood, they probably have TB. And so they would go into airborne isolation in the ER's room 4. If they have somebody in there that's in isolation, it's negative pressure. They suck all the, you can't get, the air won't come out. It's under negative pressure, so when you open the door, the air doesn't come out and infect the other area. Okay. Some procedures in here on the what you would do. You know, you would gown up. Like if you had contact isolation, you would gown up before you put your gloves on, then put your gloves over the gown, right? And then you would take your gown off right outside and dispose it. Okay. Blood-borne pathogens is just we want to use gloves, right? We want sharps, different things like that. Go in the sharps container. They're marked, they're hard plastic, they're red, or they have that biohazard thing on them. So we want to put anything that could cut you is considered a sharp. So an ampule or a broken ampule or a scalpel or a needle, it's all sharps, that goes into the sharps container. If it's a biohazard, meaning a body fluid or something, then it goes into the red bag, correct? So keep that in mind there. Then it comes in here, never recap a needle. Use this scoop motion if you have to put the cap back on it. And then one of those duh factors, you wouldn't pick up broken glass or anything with your hands, right? Bare hands, because you're going to get cut. Don't overfill the sharps containers. There's the people who are in control of that handling of and uses of these sharps containers. About when they get about 3/4 full, half full, somebody comes around. You've probably seen them. They come around and they pick those sharps containers up. They don't want them to get too full. And then I think the last couple things. Any questions? I know I'm going through this quick, but it's pretty easy stuff. We really talked about it before. Okay. Sanitation disinfection.
Sorry. Like the bed sheets and all of that. So say that a patient was there and they used blankets, bed sheets, and they didn't really like wet them or anything. Do you still put that like with biohazard just in case, or do you just put them in the linen?
In the linen. That's a good question. What about bed sheets and everything, right? You wouldn't necessarily put even if there was blood on the bed sheet, you wouldn't put that in a biohazard bag. All the linen in the hospital they consider that biohazard. So they take care of that through the laundry. Okay. Sanitation disinfection is what you do on surfaces. Like the surface here, you wipe it down with a bleach type infect, 10% bleach or whatever, or those wipes in those containers, right? You wipe them down. Sterilization is different. That's absolutely killing everything on there. So you have surgical instruments. You have different things in like for sutures and different tools that are like metal. Anything that would go inside the body, I think would. If they wanted to reuse that, then they would have to sterilize it. And the way they do that through an autoclave. So they take that metal piece of equipment, I can think of a couple, but most of them, like for sutures now, it's all disposable. They throw all that stuff away. Okay, so hang on a second. So let me grab a couple of things right quick. Because this is, like these things here, I got these out of a suture kit when I worked in the ER because they were clean. The doc didn't use them. Yeah, they're good. Because the fact that they were going to throw them away. They were going to put them in a sharps container. Okay, they were unused, so I just put them aside for class because they're still clean, but most of those kits now, because they don't want to spread infection, they don't want to take the risk of it not getting sterilized, they just throw a lot of stuff away. A lot of stuff is disposable now, okay? So they would just dispose these. These things are great for fishing.
Oh.
You get the hook and you go in there and remove the hook. Back in the 60s, they used them to smoke dope with, but you put the little joint there. Y'all don't know anything about that. They don't use them anymore. They just use different devices. But those are they're disposable. There's different ways to do the sterilization. Heat kills everything. Okay. Water, the chemicals, gases, they use ultraviolet radiation, steam, but a lot of this goes through the autoclave. Okay. Even in a swimming pool, there's those little things that as the water goes through the filter that you can put on there that puts this ultraviolet light through there, and it kills all the germs as it goes through in the water. It's a little attachment there to put a different light on it. But just read through that be familiar with the different way they kill the germs and the bacteria with an autoclave. And then hopefully you never get stuck with the needle, okay? But if you do, there's a procedure for that. The first thing that you're going to do, if you get a dirty needle stick or a needle stick, you're going to go over there and wash that area with hot, soapy water, okay? And then the next thing that you're going to do is notify your supervisor. So go over there, wash it down, iodine, hot soapy water, your supervisor, every medical place, doctor's office, everybody has an exposure plan on what you're going to do if you get stuck with a needle, okay? Or something. Or you get exposed, or a splash in your eyes, right? Get a splash in your eyes, you're going to rinse your eyes first, then you're not going to go do something that's going to delay trying to kill that microorganism that's in you now, right? So then they're going to set up a medical exam for you, draw blood, and then there's always paperwork involved in it, right? So and then they may put you on medication just in case, prophylaxis means just in case. They'll go ahead and start you on this medication, okay? Here's the thing, and I'll have to look up the law. I can't remember which one it is. Let's say you're drawing blood off of a patient and you get a dirty needle stick, and the patient refuses to allow you to test their blood for infectious diseases. They can't do that anymore. Used to they could refuse, but now they can't refuse. There's a law that came out, and I can't remember the name of it, but they're going to test that patient. So if I'm over here with Steve and I get stuck, and by a dirty needle I get an exposure, they're going to test Steve's blood for infectious diseases, okay? I did have a dirty needle stick. I went through the whole process. Somebody left a sharp on a cabinet, and I walked up to the cabinet and it stuck me in the belly. Okay? And man, was I hacked. But they wanted to start me on this medicine, and they had progressed greatly since then. That was a long, long time ago. But they were saying, if you were a year older, we wouldn't even do this. We wouldn't give you this medicine because of the effects on the liver. I'm like, I'm not taking it then. But they do have the medicine that they start you right away on, and it's much better than what it was in the past. Okay, it is very hard to get. Hepatitis B, not so much, but AIDS and different things people think about, it's very hard to get. AIDS doesn't live hardly any time outside the host. Hepatitis B lives a long time outside the host. Okay, so that's a little bit easier to get. But everything has to be right, I mean, your body's don't go up there and fight that. They're going to give you medications that's going to fight it. You washed it off as soon as you got infected, right? So there's a lot of things going for you on an exposure, and not so much against you. Okay, so don't let that. I've had people, not take certain like EMT classes and stuff, older adults, because they were afraid of exposures. It's like, man, do you drive a car? That's a much greater risk than you getting some sort of blood-borne pathogen, right? Anyhow, so look through the procedures there, 82, 83. All right, if you do, what's the best way not to get exposed? Well, be careful. Be aware of what you're doing. Okay, so if you're around needles and blood and everything else, be aware of what you're doing. You know, if this patient has HIV, be aware of that. Okay, it doesn't make any difference, but just be aware of it and be a little extra careful. I think everybody has HIV. Everybody has AIDS. So I'm super, I think all you have AIDS, you know. Infection control wise, I think every one of you have AIDS. So I'm going to be super careful no matter what. It goes back to that mindset that we talked about, you know. Be careful of what you're doing. Don't make assumptions. Okay, last thing. Materials safety data sheets on page 84. If there is a chemical in that area of where you work, there's going to be a material safety data sheet there, and it tells you a lot about it. Identifies it, hazards, what it's made of, first aid measures, if there's a firefighting aspect of it, if it releases, if it gets on you, how to handle it, how to destroy it, is it stable, is it toxic, and any other information. It's going to be there. Several years ago, I don't know how many, but they done away with the book. It's a material safety data book, and it's yellow. You'll see one in the ER. It's hidden back in the room, okay? But they used to have those everywhere that had chemicals. Now it's all on the computer. So they don't necessarily have to have the book. They can get online and find that information out really fast. Whereas before you had to look through this big thick book to try to figure it out, okay? But that's what that is. If you hear these, it's material, it's by OSHA because that's a safety thing, okay? So OSHA requires that they have this information, okay? You just don't want, like if you have a substance there and it gets on you, like if you had a powder substance that got on you and it's still starting to burn, what would be your first instinct to do with that powder's burning me?
Wash it off.
Wash it off, right? Water. I'm going to wash it off. And then when you washed it off, all of a sudden then it really started to burn. Because
So now you dry
it
it.
reacted with water. So that's why we have the data sheets. It says do not rinse with water because it reacts with water. It burns a little bit now, but it burns a lot with water.
What kind of drug was that happen?
Have you guys ever been around in road construction? And
Yes.
you know they're digging up the roads and all this dirt,
Texas.
and they put you see all that white stuff that's on the dirt.
No. But yeah.
That's reactive. If you put water on that, you're going to light somebody up. It reacts with water, not huh?
That's what I was thinking.
Or if it rains, you don't want it on your skin. Yeah, you want to keep that stuff off your skin.
Does it do anything to your clothes? Just like eat it away?
No, it's
Oh,
just
okay.
but to skin it's there. It reacts. So you don't want that stuff on your
What's that powder called?
lime.
Oh, that.
Yeah, it hardens the dirt. I didn't know this until I asked somebody. By the way, I knew it reacted with water, but I didn't know what it did to the dirt. So, in the EMS world, you have a patient, you have a rollover, and they roll over into that. They roll over their car into that stuff. It's a hazardous material. Then you have to brush all that stuff off the patient, and then you don't want it on you, right? So there's a bit of a process that you have to go through. So, not everything you can just wash away with water, okay? And you definitely don't want it in your eyes, right? Just be careful with that. Any questions over this infection control, blood-borne pathogen, precautions, gloves, anything like that? All right, that does it for the book. Now we just have to Ready 5 more times, yeah.